Yeah, Dr. T here with Erin and Dr. Jen at the Henry Schein booth, and what caught my eye was this little setup here, and we'll talk about that. As you know, I'm here to talk about technology and how technology can help me as a practicing veterinary and you as well as a practicing veterinarian. I think we've got a little great post-surgical setup here that's really good.
Talking about the full suite of both operatory and rehab products that we have here at Henry Schein, and what we're really pushing here and talking to people about is not just performing an awesome surgery, which we know you guys will all perform, but also taking it to the end and going through rehab and really pushing best practice medicine for your clients and also for you. So we feature here a full line of rehab products and solutions that we are talking to all of our attendees about today, basically going from laser treatment, which both the technician and the veterinarian can perform, stance analyzers to make sure you have a proper diagnosis, and then a really exciting product that I can't wait to show everybody is the Digitherm, which is a thermal imaging device, which Dr. Johnson can elaborate on.
I think the Digitherm is the most exciting new innovation for general practice, because our issue is always identifying and evaluating our patients for pain in an objective manner. So the stance analyzer can help because it can identify weight placement, but it isn't going to help to identify painful procedure that might not be entirely musculoskeletal. So the thermal imaging makes sense because it's measuring changes in thermal gradients. So where there's an increase in thermal gradient, there's going to be increased inflammation. If there's going to be a decrease, maybe there's muscle atrophy or nerve impingement or something that's causing a decrease. And the whole idea is the patient is symmetrical, so you're able to get images that are visual that you can share with your clients, and you can say, this is a clue, this is a spot that we need to look at. So of course for diagnostics, I think that a thermal imaging camera should be right next to your thermometer, your stethoscope, and you should do a TPR and take pictures of everybody. Now as far as recovery after surgery, so you do knee surgery, you're going to be able in general practice to provide great rehab to your patients, because you're going to be able to monitor them with the thermal imaging to see how they're progressing, and then you're going to be able to do something simple like range of motion and laser therapy, which is so technician driven, which I think is great for general practice, because technicians can basically take over that therapy and learn about the modality and how to apply it, and then able to follow up.
And I think an important point that has to be said is that you come from the general practice world, right?
Yeah.
So it's not like we're talking about referral center rehab. We're talking about what you can do in your own day practice.
Yeah, and I actually think that it makes more sense to general practice. Everybody in referral practices, and I have nothing against surgeons at all, but they're not interested in this. We're interested in this. We're interested in that holistic approach to our patients, which this provides. We imaged some people today, their knees, so. What?
That's scary.
So this is a thermal image of one of our attendees today. We just did it, and we said, let's look at the symmetry between your legs. And she didn't tell me which knee she needs surgery on.
But you can tell.
But can you guess?
Oh, wow.
It's the right
It's
one.
the right.
So she has an increased thermal gradient here compared to the left, and it was one picture obvious. Easy way to identify what's going on in our patients. And this is what I would consider to be a scanning tool. So you scan every patient. Now a lot of them will be normal, but you may find something that's not normal, and there's where you have the clue to be able to further identify, say, maybe we should take radiographs. And so many times in our patients, we're not having a response to palpation, and this is a clue.
It's another tool. It's the way technology helps advance our profession and make it better medical care for your pet. So Erin, Dr. Jen, thanks so much. Appreciate it.
Thank you.
watching, and if you like today's show, please subscribe. And remember, love your pet like they love you, unconditionally. Have a great day.